All righty, everyone. Good afternoon to those of you on the East Coast, and good morning to those of you in the Central, Mountain, and Pacific time zone. I'm Dr. Michael Jones, and we're here to talk about how you can make your medical exercise training practice referral ready in 30 days. All right, 30 days. So now let's talk about what referral ready means. That you can receive referrals from doctors, therapists, chiropractors. You can now bring these new clients in. And as you bring these new clients in, you're able to also manage these clients appropriately so that then you can follow up with the doctor, therapist, or chiropractor and share with them the progress the client is making. So this isn't just simply about getting a referral. This is about getting a referral and then being able to follow up on that referral and provide the physician, the therapist, the chiropractor with everything they need. Now, please remember, when a client is referred to you, they're referring that client because the doctor, therapist, or chiropractor feels there's a medical necessity. Please write that word down. Medical necessity that the client meets that says they need this program, this exercise, to continue on in the management of their condition. So it is only professional, and most importantly, it is necessary that you communicate with the doctor, therapist, and chiropractor in a professional, succinct, and timely manner on an ongoing basis. So this isn't just about getting referrals. It's about how you make your practice referral ready in 30 days to receive referrals, follow up, and then communicate back with the doctor, therapist, or chiropractor. So thank you for joining us. This is day number 5. And on day number 5, guess what, folks? We're talking about define your ideal referral sources. Now, let me say this. Just because a doctor, therapist, or chiropractor is out there and they have their shingle out and they have a practice doesn't mean they're a good referral source for you. So we're going to talk about defining your ideal referral sources. Now, folks, I'm retired now. I sold a bunch of physical therapy clinics back in 2001. And we sold them for enough money that I could retire, not have to work the rest of my life, myself and my partner. That's not to brag, but it's to impress upon you. You can do this. And I started out in a closet in a health club. And I built it to 8 PT clinics. And along with that, we had 2 nursing homes and also a fitness center that we sold. And here's the thing we realized. We needed to develop relationships with specific medical providers. For us, it was physiatrists as well as orthopedic surgeons in our community. And we wanted to become extensions of them in that when they referred a patient to us, we were going to take care of all their therapy needs and then also transition them out of therapy back into our medical exercise program, back onto the field, back to work, or back to whatever they're doing. So with that, you have to select ideal referral sources, not just any and everybody, but ideal referral sources. That's what we're going to talk about this morning. Now, as I mentioned in previous broadcasts, we have a couple of manuals that we recently produced. Our Cracking the Code manual, if you want to deal with insurance carriers, it's the ultimate guide to medical exercise reimbursement for your services, is 399 pages. And then we also have our Advanced Medical Exercise Specialist manual. I'm showing you the hard copies, but we're selling these as digital copies. That AMES manual is the operating guide for medical exercise professionals that are building their practices. We've taken everything we've learned in 31 years, and put it into that manual. Forms, guidelines, systems, marketing guidelines, everything you want in protocols is in one manual. You can buy both of them as digital documents, and I would recommend you get the digital, folks, because you can carry it around on your cell phone and also on your iPad, any and every place, like I do mine. And those digital manuals have media links in them so you can watch some videos. All right. So we got the commercial out the way. Let's move on and talk about defining your ideal referral sources. Now, this is going to be quick, to the point. We've done this now for 31 years. And folks, we've helped a lot of people build their medical exercise training practices, establish referral sources. And one of the first things you need to do is define who that ideal referral source is. So before we get to that point, let me remind you, your scope of practice as a medical exercise professional: MET assessments, cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education. Emphasize that. Put an asterisk beside it when you write it down. That's going to become bigger and bigger: aquatic training and stabilization training. Now, let's start with your niche. If you're going to go out and get referrals, you have to have a niche. Now, we talked a couple of days ago about your niche. We talked about elevator speeches. We talked about all of that stuff. Now, let's start thinking about your niche or niches. I recommend all medical exercise professionals have at least two areas they specialize in or their niches. Two, three, great. I recommend at least two. Now, that doesn't say that if a client has a condition that's outside of your niche, that you say you turn them away, because I understand everybody's in business. But also, you don't go out pursuing referral relationships with doctors, therapists, and chiropractors in realms that you have no understanding of, or you just took the workshop on Friday and Saturday. Now, Monday, you're knocking on their doors to get referrals. Folks, understand these people that you're knocking on their door, knocking the doors of, are highly trained professionals. They're looking for you to provide the same standard of service and care to their clients. They don't want you calling them asking them, hey, doc, what do I do about this? Or what do I do about that? They want you to give them solutions and ideas on how exercise can best help their patients improve to the level of full function as your clients. So the first thing I'm going to do is start with your niche. Is your niche neurologic clients? Is your niche total joint replacements? Is your niche maybe working with post-cancer clients? And you can have multiple niches. I would say up to 2 or 3 niches, because when you get 4, 5, 6, 7, you're not good at anything. You're a jack of all trades, but a master of none. And remember, that orthopedic surgeon, that neurosurgeon, that neurologist, that physiatrist, they're specialists in their area, and they've seen a wide range of conditions in that area, and they're expecting you to do the same. So please, if you would, note the 2 or 3 areas that you consider to be your niches, in that you've produced outcomes for clients that were positive functional outcomes. You've got the additional training, and you feel comfortable working with these clients, comfortable enough that you can communicate with the doctor, therapist, and chiropractor about exercise and not feel like an imposter. That's number 1. Number 2, research local practices. Don't just simply look in the phone book, or you drove around the community and you saw all these therapists and all these chiropractors. You wrote down their addresses. Do a little research on them. Try to find out at least what their area of specialization is by just simply doing what? Picking up the phone. You don't have to tell them who you are. Well, I'm a prospective patient, and I just wanted to get an idea of what your areas of expertise are. What are your areas of specialization beyond just simply being a physical therapist or a chiropractor or a physician? For instance, in our offices as physical therapists, we specialized in outpatient, or I should say outpatient post-operative orthopedic surgery. So we saw ACL tears, rotator cuff tears, spinal fusions, laminectomies, anything that involved an outpatient procedure from an orthopedic standpoint, we saw. So we saw a lot of professional level athletes, college level athletes, but we also saw the average Joes and Susies that had knee replacements or ACL tears or meniscal tears. We researched our community after we realized what our niches were. We researched our community and went after those orthopedic surgeons, general practitioners, family practitioners, physiatrists that specialized in those areas. So we did some research. With that research, we also found the name of the office manager in each one of those practices. Folks, that's the best information I ever got. Now, I've been married multiple times. My first wife told me that, and that's the best thing she ever told me. And I'm not putting her down. She's a fine woman, but that was one of the best things she ever told me. You know, you might want to find out who the office manager is, because the other day when I went in for my appointment, I talked to the office manager. She told me all this stuff. So what we did when we started doing the research, we found out who the office manager was in each one of those offices. The office manager is the gatekeeper. Now, folks, as I said, I own 8 practices. We had a young lady who was my office manager named Dana. Dana was maybe 5'2". I'm 6'2". Dana basically ran the office. I did the clinical side, she did the admin side. But I knew if Dana put a vendor, which is what you are, on my schedule, I needed to talk to them because she had the best interest of our practice and our patients in her heart, and I needed to talk to you. Also, there were plenty of times Dana would come to me and say, hey, Mike, we need you to sign off on something here because I need it for one of the vendors. Great. She became my right hand, and she could become your best friend. So with this research the local practices, find out who the office manager is, find out what their hours are, what they specialize in. Go out and look at and see if they have reviews. When I was practicing, we didn't have reviews, but here's the best way to know if the practice is good or not. Do people in the community say, yeah, that's a good place? Now, I'm going to use an analogy here that is kind of interesting. I moved to Houston about 10, 12 years ago. I met my wife and we got married shortly after that. And one of the first things when you move into a new community is if you are, you're looking for a place to get your hair done. Now, I don't get my hair done anymore, but when I moved to Houston, I did. I remember my wife told me when she moved back here, she had to find somebody to do her hair. She also had to find somebody to do her dry cleaning. And then also eventually get to the point where you got to go to the doctor. You ask people in the neighborhood, and what do they say? You ask friends in the area, people at the church. And if you find a couple of doctors' names or therapist names or chiropractors' names keep coming back, those are the people you want to see. All right. Not the guy or woman that has the best and glittery office, but the one that actually people in the community say. And not the one with the best advertising. They spend a lot of money on advertising, but do they have the skill set to produce outcomes for their patients that become your clients? So do a little bit of research on the local practices to determine who should be on your list. And that takes us to the next thing. Create a target medical marketing list. Now, when myself and my partner, a gentleman by the name of Jeff and I actually ironically met on a television show. I was being interviewed on a local TV show in DC. It was a news segment. He called in. We were competitors, but we didn't know it. Well, a couple of days later, we got together. And then about a month later, we decided, hey, man, you know what? You're doing the same thing I'm doing. Instead of fighting each other, let's actually merge our practices. So we merged the practices. And I remember we sat down in my basement after we signed off on all the documents. And we said, okay, who are we going to target as far as referral sources? So what we did, we came up with a list. We had 6 medical providers on our list. They were all orthopedic surgeons. So Jeff took 3 and I took 3 and we started knocking on their doors, marketing to them and trying to get to know them. So please, if you would, make a note. Don't just send out your brochure or an email blast to every medical provider in the community. Do your research. Once you've done that research, come up with a target medical marketing list. On that list, you should have no more, in my opinion. Now, we're recommending in this program that you have up to 5 to 10, but you're not going to actively market to 10 medical providers at the same time. I recommend on that list, you segment it and you market it. If you're an individual practitioner by yourself, market to 3 at a time. Starting out, for many of you that are just starting out, you're just getting your feet wet with this whole idea of marketing to the medical community. Let me give you the 3 that we found over the last 30 years, teaching medical exercise specialists all over North America and also around the world. 3 referral sources that we find are very open to the idea of referring their patients to you as clients for medical exercise. Number 1, general practitioners and family practitioners. Folks that are gatekeeper to the healthcare system. They see hypertension, diabetes, low back pain, sprains, strains, meniscal tears, back injuries, knee, and they see everything. And they know physical therapy works, but they also know that some clients after physical therapy is done need something else, or they just need a good weight loss program, or they need a good strengthening program. Okay, talk to the general practitioner, family practitioner. They're the gatekeepers. They can refer a couple of clients to you, hypertension, diabetes, back pain, and all of these individuals have already received medical care or even physical therapy care, but they now need to come to you. So first on the list, general practitioner, family practitioner, okay? Number 2, a chiropractor. Now you say, Dr. Mike, a chiropractor? Yes. We found across the board for the last 31 years that chiropractors are the most receptive medical providers to medical exercise, medics pros, I should say, or medical exercise training professionals across the board. They realize that what they're doing with their manipulations and their spinal or joint manipulations, that exercise is a necessary component of the medical management of that. You may find some chiropractors will invite you into their offices and allow you to share space. I know a good friend of mine in Detroit, Greg Ryan, is doing that. Not only does Greg do massage, but he also is a medical exercise specialist. He's doing that in a couple of chiropractors' offices there. So this idea of chiropractors referring clients to you or maybe bringing you in as part of the staff on a contractual basis to see clients there, it's a great thing. So that would be number 2. And then number 3 would be a sports medicine or physical therapy practice. Now, notice I put them on the list number 3. Here's the reason why. Make sure that you've got that elevator speech down to a science so that when you walk in the door, you clearly understand your scope of practice. You clearly can delineate and articulate who you are, what you do, how you do it, and who you do it to. So you don't step on that physical therapist's toes, because the first trainer that ever came to me looking for a referral back in the early 1990s said, oh, Mike, we do the same thing. Okay, well, if we do the same thing, you can get out of my office and let me get back to seeing my patients. So that was our first encounter with a trainer some 32 years ago. Now, that's stuck in my mind, and I realized I need to make sure that as a medical exercise professional, you clearly delineate your role, your scope when you go out and you talk to physicians, chiropractors, and also to physical therapists out there. And it's not trying to protect the therapist realm. I'm telling you what I've learned over the years teaching these courses and some of the feedback I've gotten from our MES graduates, as well as from therapists out there who call me about people who come in their office and are trying to market to them to refer clients. So establish a target medical marketing list. Now, in our literature, we say 5 to 10. Great. But you're only actively marketing to 3 at a time. Because think about it. If you're a solo practitioner, can you market to 10 people at a time and keep your wits about you? No. Let's do 3. Now, for every additional staff member that you bring on, which means you bring on a staff member, you now expand and add an additional person to that target marketing list, additional medical professional. So as you're expanding, you're now having to fill this new person's schedule. You go out and you do more marketing. You now get referrals coming in. And lastly, think about this. If you're a solo practitioner, you're out marketing to every medical practice in the community, and suddenly something pops. Suddenly somebody says, okay, we're going to start referring clients. How many new clients can you take next week? How many new ones? So that you can assess them and give them the proper frequency of visits in your practice. So be careful and be mindful of the idea that as a solo practitioner, I have to market to the scale I'm able to manage. And then as I add more staff members, I ramp up my marketing. So look at the list, 5 to 10, but you're actively marketing to 3 at a time. All right. Let's see next. Study their language and focus. So one of the things we did, we started to get to know some of the orthopedic surgeons in the community. And yes, you do need to try to get an idea of what their backgrounds are. Now, if you want to break the ice with a physician, find out where he or she went to medical school, even undergraduate school. You can find this stuff online in most instances. If they have a practice, they've got a bio page, find out where they went to school. Folks, everybody genuinely remembers their heyday and their happy days when they were in college and in medical school or PT school or chiropractic school. I had a gentleman once who was the president of the American Academy of Orthopedic Surgeons. We were marketing our services to him, and he was a Meharry medical school graduate out of Nashville, Tennessee. Oh, I told him, hey, doc, I heard you went to school at Meharry. He's like, yeah, I went to Meharry. We talked for 20 minutes about Meharry. And then after that, we started talking about everything else. And because of that, it broke the ice. From that point on, folks, when I went by his office to drop off referral pads or do anything I need, documents I need to have signed for a patient, he would stick his head out if he heard me out of a room. Hey, Mike, come on in, sit down in my office. And we would sit there and talk about some of the times in medical school he had, where he was from. He even referred his brother and his sister to me. So please remember, folks, these are ordinary individuals that went to medical school or PT school or chiropractic school. They're not super people. They're average people, and get to understand them. For instance, this one doctor always talked about the idea of sludging out a knee. I realized what he was doing is he was flushing a knee out after when he did a scope. He said, Doc, he said, Mike, I'm a drain them out, and then I'm gonna send them to you. Oh, Doc, what do you mean? Then I realized he was just going in and just simply flushing out the knee, cleaning out all the debris, and then he was going to send them to me. Now, you're not going to do anything at that level with regard to post-surgical clients, but understand their language and understand their focus. A couple of orthopedists we had wanted us to focus on the first couple of sessions, just activating the quadricep and getting the patella to track normally after knee surgeries. So you've now got to start to understand their language, their focus, which means you may have to spend a little bit more time talking to that medical provider that's your go-to person to ask questions so you can better understand the language and the focus of the medical provider you're targeting on your list. And then lastly, prepare to build a relationship. Relationship. A relationship isn't a parasite. A lot of our MESs want to just get referrals. Just send me referrals. Folks, you got to send referrals back. You have to follow up. You have to have a relationship. Now, tomorrow's my wife's birthday. We've been together almost 10 years now. Before we got married, we had a relationship. I knew her. She knew me. I knew what she liked. If she loves Chinese food, I didn't take her to Italian for her birthday. and her birthday is tomorrow. So guess what, folks? I'm going to take her to the restaurant she wants. She has one restaurant here in Houston that she loves. That's where I book reservations for. So it's a relationship. It's not just simply you're taking, but you're giving. When you have clients that are appropriate and they don't have a physician, therapist, or chiropractor record, refer the client to them and send a letter to the person you're referring them to that says you've given them the referral. We've done that with a number of orthopedists over the years when we were in practice, and we found out that actually makes the medical provider realize that you're helping them and they're helping you. It's a two-way street. Prepare to build a relationship and not just prepare to make a pitch. Just going in and making a pitch and never doing anything for the referral source doesn't work. Now, let me mention one thing. Don't get caught up in the idea of if they refer to you, you're going to give them some monetary remuneration. Wrong. One of our MESs told me that a couple of years ago, and that allowed me to blow up on him because I'm like, that's unethical. It's inappropriate. It's illegal. If that's found out, you can actually be prosecuted by the authorities. But think about the medical provider that's looking for you to give them some monetary remuneration for referring a client to you. Would that be a person that you want to see and have treat you or your family members? No. So when we talk about preparing to build a relationship, this is a communication relationship. You get the referral. Hey, thank you for the referral. We appreciate it. I'm going to get the assessment summary over to you as quickly as I can. You send that assessment summary in a timely, in a professional manner. It's short, it's concise, it's to the point, and that's how you're going to communicate. This relationship is built on the idea of ongoing professional communication that's done in a timely and a professional manner. So relationships, and don't forget, you can refer, they can refer to you, but make sure you understand it's a give and take relationship. That becomes important. And with that, we're done. That's the basic idea of determining who you're going to market to. Again, make sure you do the following. You work with referral sources or look at your niche and determine referral sources. You do some research on local practices. You establish a target marketing list. Yes, you can have 5 to 10 on the list. You're only marketing to 3 at a time. Also, along with that, you study their language and their focus. This is also where, folks, we ask you to go out and do those observation hours in a physical therapy or chiropractic clinic. As you're sitting there observing, you're hearing terms, you're hearing about doctors, therapists, chiropractors in the community, and that allows you now to understand their language and their focus. And the last thing, you're building referral relationships. They go both ways. And make sure that you have the necessary systems in place, documentation, communication systems, so that when you get a referral, you can follow up and give that follow-up that's necessary, that communication necessary to build a relationship. And with that said, this is all part of our MES network. And please make sure that you register for our ongoing series, Cracking the Code. It's our webinar series for MedX Pros to help you build a profitable practice. And I got one special offer for you today. Now, folks, the reason we're doing this 30-day challenge is because I'm tired of hearing about medical exercise professionals who are barely making it. I'm just tired of it. Folks, I just turned, I'll turn 64 this year. My wife has a birthday tomorrow, and she'll be a year older than me. Now, with that, we got our aches and pains. We're trying to play pickleball these days, all right? Never thought I'd play pickleball, but we're trying to play pickleball. I got an achy hip, problematic knee, but I'm still playing. To say this, the reason I'm upset about this is because the number of individuals over the age of 55 in North America is growing exponentially. With that, we have chronic diseases, aches and pains. We're going to the doctor, we're going to the therapist. And with that, they're telling us to do what? Go exercise. All of you, every medical exercise professional, you should have a full practice at this point, a full practice. And with that full practice, you should have tons of clients. You should have great referral relationships with the community, and you should be doing exceptionally well. So with that said, we're asking you to take a look at our MedX Pro Jumpstart coaching program. Now, what we do with this program is you get one 90-minute coaching session. You're going to do it with me. And folks, over the last 31 years, we've helped hundreds of medical exercise professionals build practices, start getting referrals, even deal with insurance carriers. And folks, I can tell you, I've done it myself with my own medical practice, my own physical therapy practices, and helped others. Folks, it's the same basic fundamentals. We've done it over and over. Now, I know there are a lot of people out there that are telling you things, but folks, have they actually done it? Have they actually developed numerous relationships with medical professionals, from chiropractors to other physical therapists like us, as well as to physicians? And they can tell you exactly what you need. So you get a 90-minute coaching session. Folks, it's going to end up being 2 hours because you're going to do the coaching session with me. And as you can tell, I love to make sure you have the details and the understanding. You're going to get follow-up text messages and emails with me. I want to see you successful. So that 90-minute coaching session is probably 2 hours and then a number of follow-up emails. You're also going to get a copy of our AMES manual. You're going to get the digital copy that currently is now 1,128 pages. You're also going to get a digital copy of our Cracking the Code manual. We're also going to give you the essential forms you need to build your medical exercise training practice. We're going to personalize them with your logo, your contact information, like referral forms, release of information forms, medical clearance forms you're going to send to the doctor, session logs, so you can start documenting everything that you're doing and share that with doctors, therapists, or chiropractors. Because you're getting into Cracking the Code manual, we're going to introduce you to the idea of how to seek insurance reimbursement. We're even going to give you medical communication templates. That's right, a template that is an introductory letter that you can send to a doctor, a follow-up or progress report letter, session logs. Every type of communication that you need is in this in these templates. We're going to give them to you, and all you got to do is open up in Microsoft Word, type in your information, and there's your template, a letter you can send off to the doctor. We also will give you access to a program that we developed a couple of years ago. It's a 6-session online training called MES Jumpstart. It walks you through clarity, systems, marketing, everything you need. You'll get access to that through our 3-month membership in our MES network. And guess what? We're doing all of this for only $299. I'm going to sit with you for 2 hours. We're going to dig deep and helping you figure out how to make all of this stuff work. Because I realize you got referral forms, you got letters, you got marketing, you got this. We're going to pull it all together. So go over to crackingthecode.net, get registered. This offer is available till Sunday, so take advantage of it now. And if you want to get those manuals, you'll get them along with this special offer. But if you've already purchased a manual, we're going to take that price off of the Jumpstart coaching session, and we'll reduce it based on what you paid already. Now, there are other packages for this. We have a 3-session packet. We have a 6-session packet. But we're just going to offer this basic package for you right now if you're interested. So with that, thank you for joining us. We appreciate your time of being here with us. And please, we won't have a session tomorrow. Tomorrow's Vera's birthday, and I'm going to be out there enjoying our day. We will have a session again on Friday, and then we'll pick up again next Monday. So today was day number 5. We'll pick up with day number 6 on Friday, so we're going to miss tomorrow. And thank you all for being with us. Best wishes building your medical exercise training practice. And please remember, establish that target marketing list. And that marketing list should be based on your niche, the areas that you've produced outcomes in, so you don't feel like an imposter, you feel confident. And remember one last thing, you're providing exercise expertise. You're the exercise expert, not the doctor, not the chiropractor, not the physical therapist, from the standpoint of the exercise you're providing. Let them know that. And please step up to the plate and say, I can provide this exercise programming for you. But make sure you use a target marketing list. Make sure you're developing a relationship. And along the way, make sure you have a good elevator speech. So with that, we'll see you next time. All the best. Take care. We'll see you on Friday.